welcome to the HIMSS pre-webinar, Breaking Down Healthcare Silos. I'm your moderator, and that was sponsored by the Patientory Association, I might add. I'm your moderator, Jonathan Fuchs. I am a board member of the Patientory Association and also the chief operating officer of a company called Kidder Street Consulting Group, which is a healthcare strategy and health IT enterprise software consultancy. We have a great program today with three marvelous speakers, Doug Williams, Krista McFarland, and Mazen Gadir. And just some rules of the road. If you will mute your phone, so I think everybody would be muted. We'll have an opportunity for questions at the end. And I think if there's a chats opportunity, otherwise we'll have a panelist discussion. So let's get started. And our first speaker is Doug Williams. And Doug is the Chief Product Officer of lupHealth. And previously he was the CTO of iSpecimen, building an online marketplace platform to connect life science researchers with patients and biospecimens at the healthcare providers who have them. And in previous roles, he led technology teams at Runkeeper, Family Education, and Zipcar. And he is a graduate of Princeton and Harvard with degrees in computer science, electrical engineering, and an MBA focused on product development and international growth. And his topic today will be the intersection of FHIR and government opportunity in terms of health IT and blockchain. Doug, you're on.
Yeah, thank you very much, Jonathan, and Krista. Thank you for inviting us to participate and work with you in the Patientory efforts. So, as Jonathan said, I'm Chief Product Officer of lupHealth. Want to talk about the developments that are occurring in terms of interoperability to enable a number of the initiatives we're talking about across the healthcare industry, specifically in the area of the FHIR standards, the fast healthcare interoperability, and then enabling the types of work that Patientory is doing to free up healthcare data and then store it securely in blockchain or other methods. Next slide. So these are the shifts that are occurring, and it really is a private-public partnership in healthcare. It requires leadership and innovation at the government level. So these freeing up our healthcare data and modernizing how the data is shared has bipartisan support. So we've had initiatives that launched Meaningful Use 1 during the Bush administration. A lot of the new API work started during the Obama administration, and now these initiatives have continued through the last into the present day. So the most notable regulations that came out are from the Office of the National Coordinator as part of Health and Human Services, regulating the provider practitioner data, working with the EHRs like Epic, Athena, Cerner, how they share data, and then CMS that regulates Medicaid and health plans, essentially to mandate that Congress had mandated with the 21st Century Cures Act that we have access to our health records, and then mandating that be through FHIR APIs. So those final rules came out in March of 2020 and are going into effect on the health plan side, went into effect just last month, July of 2021. And then on the provider side, they were extended for COVID and go into effect in 2022. So the first thing is mandating of data must be available to all of us via FHIR APIs. The second is as we move from a more transactional healthcare system. We want to look at the whole of care. So if you get your COVID shot at, say, a CVS, and then your care is through a practitioner group, you want a place where you can pull it all together, look at the costs, and value-based care initiatives are really driving the sharing of data from health plans and health providers. That's also driving use of the new FHIR technologies. And then finally, the cloud-based initiatives in particular, but and then open source is really driven on the technology side, what we can do in terms of economics and the tools that are available to us, where we're getting orders of magnitude higher performing tools at orders of magnitude lower costs. So this catalyst is really driving innovation in healthcare. Next slide. In terms of lupHealth, starting with work with Anish Chopra, who was President Obama's CTO, and continued with partnership with Boston Children's, we've been able to innovate and lead inside the FHIR space, working with innovative partners on the government as well as private sector level. So Gardner had seen this move forward and has been looking at this space, saw that we really were able to be the first to really bring it to market in a commercial way. The standards have been underway for more than a decade, but now with these new regulations, these are moving fully into production. And for our case, partners like Aetna, IQVIA and clinical trials, IBM, and a range of partners. And the number of APIs we can connect to now is over 10,000 connected health providers and health centers, with over now approaching 700 applications building on the platform, including the ability to make the data available in the Patientory system. Next slide. In terms of our role as working in the public and private sector, our role is to begin to move the interoperability forward. So we have partners and customers on both the payer and provider side, enabling the data to move at the patient level using the FHIR protocols, as well as the newly mandated FHIR bulk data protocols using ND-JSON for efficient population level data exchange. And so, and ultimately enabling apps, everything from automated prior auth, risk adjustment, quality measures, and biopharma and research applications. So the ability to both produce the data and consume the data and ultimately make it available to applications is our goal. And we're now able to achieve that thanks to the mandates that are mandating that data be transferred over FHIR. Next slide. In terms of our platform, we have the ability to bring data in as we work with partners and customers. We can bring all the range of their data in, convert it to FHIR, so that we've had customers with as many as 31 different healthcare data sources. Now we can bring them into our cloud-based platform and have it all in a single FHIR repository available for patient and population level applications. We can connect to the patient endpoints where patients can authorize their data be shared. In this case, connections with over 10,000 health systems, with providing immediate access where I can authorize my data be shared to a particular application of my choosing. We also can integrate directly to the health systems, the providers, as well as the payers, where there's a direct connection that's done more at an enterprise level. This is the population level, to combine claims and clinical to get a 360 view of the patients, and lead to ultimately towards more efficient healthcare when we can see the entire range of the healthcare data for patient populations. And then, as discussed, the goal ultimately is then build modern internal applications built on the same modern infrastructures that we expect in financial services and other consumer applications. So built on OAuth 2 authentication, RESTful interfaces, and JSON data payloads. Next slide. On the patient side, this is particularly relevant to the work that Krissa and the Patientory team is doing, which is enabling access to our healthcare data, and then the ability using technologies like blockchain to then store it securely. With the patient endpoints, we can provide a gateway to the federally mandated endpoints. So with the earlier regulations, we've already got widespread US rollout of these endpoints, and this will only further as the 2022 deadlines approach. So with 10,000 access to 10,000 health systems already, you can build an application, provide a single connection with OneUp, and then access data with the patient approving it across this range of providers. So this is really unprecedented, and having been involved in it early, we've worked with each of the players, and now are able to build a standard gateway, which is what we expect in other industries. It's now available in healthcare. Next slide. And this is just illustrative of the range of applications. We provide a directory on our site that lists all the applications. It's automated as new endpoints are provided. We update it there, but again, this is all possible with the work on the public side to mandate the endpoints, and on the private side to make them available, and then companies like lupHealth beginning to pull them together into networks to make them available for applications. Next slide. And then our work with the Patientory Association is directly in line with our own mission. We are looking, ultimately, our goal is to extend lives by allowing data from the healthcare system to flow more freely and securely, which is very much in line with the work that Chris is doing in the Patientory, where as part of the marketplace, we can make our endpoints available, so that as applications are being developed in concert with the Patientory Association and infrastructure, they can then reach out directly to the 10,000 hospitals and health centers available through the OneUp network. So we've done that integration, and have had developers integrate it with their efforts directly with the Patientory Association. So we're very glad to be able to participate. And if there are any questions, we'll obviously answer some here, but you can send those to product of OneUp Health, and our range of product managers will be able to answer your questions.
Thank you, Doug. It was a great presentation. I'd like to introduce now Krista McFarland, who is the president and CEO of Patientory and of the Patientory Association. She founded Patientory in 2015 as a health data analytics company, and she is devoted to fostering digital innovation in healthcare. She is widely recognized as a thought leader in blockchain and has, in fact, just recently been named to the Forbes 1000 rather. She has degrees from Cornell University and received a master's from Wake Forest University. And it is my delight to introduce Krista McFarland. Krista, you're on.
Thank you. Thank you, Jonathan, for the introduction. Great, so we can move on to the next slide, please. So as Doug very eloquently, succinctly described the challenges that we've been facing in healthcare in terms of data access and interoperability, our Patientory Association is focused on the secure storage and easily transfer and ownership of that data by using blockchain. So in partnering with the lupHealth team, we've utilized our proprietary blockchain network, which is called the P2 Matrix blockchain network. That is the only blockchain system that is also linked with a global traded cryptocurrency to enable the facilitation of the secure electronic storage of health information. And this diagram here is just a schema. Next slide. And by having this infrastructure in place, we can start to tackle not only systems problems that exist with the lack of healthcare interoperability, but also healthcare problems that arise from the inability to securely share data. As we know, in the past decade, the emergence of electronic medical records has essentially created wall gardens within EMR systems that makes it really hard to gain access to patient-mediated data. Within the P2 Matrix, the goal is to basically unlock this by deploying that blockchain-centric network, but we can also start to aggregate data that is not captured by the electronic medical records, which is namely patient-generated information through IoT and wearable devices, as well as genomic data. Where we are in this implementation today, we can take Patientory as a use case. So we've actually built a DApp, a decentralized application that lives on this blockchain network, which goes by the same name of Patientory Inc., which essentially are the products that take advantage of solving specific healthcare use cases. The first use cases that we've actually set out to solve is the ability to identify high potential candidates for clinical trial recruitment opportunities. So you can see by aggregating that data via this decentralized blockchain network, we then are able to control consent, but also give patients ownership of that data. And using the aggregation of the information, we're able to deploy more advanced AI and technology and analytics to identify those candidates for clinical trials. So via the Patientory app, with the curation and aggregation of this data, we're able to curate essentially what we call a digital health fingerprint for the user that is identified through the use of a health score. So through the accumulation of that data, the patient owns that information. They're essentially given a risk score based on the information that we collect on them. And then we're able to curate plans for them to improve their health over time. So we really see this as a solution that can also help in improving outcomes for certain patient populations. And as we see here, as I mentioned, the ability to have all of this data in one place is really the next frontier in healthcare, through the use of blockchain, through the use of FHIR-mediated APIs. We're then creating essentially a 360 view of the individual. And that concludes the Patientory use case.
Thank you, Krissa. And our third speaker is Dr. Mazen Gadir. Dr. Gadir is an advisor for healthcare strategy and organizational transformation. He is a senior consultant and advisor at the Executive Office for the Organizational Transformation for the Dubai Health Authority. He's done that since June of 2016. He's an expert in strategy development and implementation and organizational transformation. He has both a triple threat, Bachelor of Engineering, a Master's in Management, and a PhD in Quantum Electronics and Nanotechnology in Medical Energy from Leeds University in the United Kingdom. And he's a delightful individual. We know him personally. So we're pleased to introduce Mazen Gadir, who's going to talk about the international activities relative to interoperability, particularly as it relates to what's happening in the UAE and the Middle East. So Mazen, your turn.
Thank you, sir. Thank you, Jonathan. Reporting to you from sunny California after a 16-hour flight. So I'm so excited to be talking to you about some of the international activities. I hope you can hear me and
yes.
You're able to see the slides. Fantastic. Yes, excellent. So as you know, there has been a huge amount of momentum and proactiveness in the area of digitization in the Gulf Cooperation countries, the GCC area, which includes around 6 countries, UAE, Saudi Arabia, Kuwait, Qatar, Oman, and Bahrain. And today I'm just going to share with you a bit of the tsunami of initiatives that has come up in the last 5 to 10 years. Obviously, a huge impact and huge influence is coming also from the great initiatives that Doug has shared earlier, and some of the great innovation that also Chrissy has also shared. The US is sending a lot of great signs and innovations towards the Middle East, with a lot of lessons learned as well. So I'm going to present you with some slides that I worked with Dr. Usama Al-Hassan from Dubai Health Authority, who's one of the leading health informaticians in the region, to present these slides. And I wanted to give you a bit of an update and perhaps some of the areas of activeness and activity and promising expansion in the digital health space in GCC. So again, and in this slide, it shows the different initiatives that are now taking shape in implementation mode across the different digital health ecosystems, specifically with focus in the UAE, Qatar, and Saudi Arabia, where is a lot of implementation going in from digital health initiatives such as clinical services integration platforms to financial services integration platforms, as well as expansions to a huge number of HIE projects, health information exchange projects, with whatever the innovation world can bring us in this region. And again, the best CIO that has taken precedence in digital health is COVID-19 in the last 2020, that pushed a lot of these initiatives down to reality and implementation avenue. And that's why it has become a huge trend, from cost effectiveness to universal health coverage, sustainability, and now the realization of the importance of public health. GCC has been always working to bring public health to the highest level of priorities and drive informatics in a public health framework. And this has been the norm and the trend since 2020 has come to us. And that's why in the next slide, if I may just go to the next slide, the concepts of Internet of Things, even IOBTs, or Internet of Behavioral Things, things like 5G, the unfolding of the magic that 5G connectivity will bring to us, telehealth that has become a mainstream activity across the region, the concepts of universal health coverage, and claims post office that has become a trend across the region. And I'm talking not just about GCC countries like Saudi Arabia, Qatar, UAE. That are driving at the leading position in driving innovation, telehealth, driving track and trace capabilities, health information exchange capabilities, but also they are influencing neighboring countries such as Jordan, Egypt, and India. Actually, India is one of the biggest markets that are expanding in the area of national health insurance programs, and that brings in the digitization might with it. Obviously, with the population explosion that is happening in heavily populated countries like Egypt and India, and soon to be Nigeria, we are seeing a lot of momentum in the area of digitization in the concepts of healthcare finance and healthcare clinical services integration. So again, this just gives you a bit of an understanding of how this region is influenced by the knowledge and the innovation that is coming mostly from the West, as well as trying to take some leading positions and some primary polling position in the area of driving this innovation, customizing it, and try to bypass the West in the areas of, specifically in some of the areas that we are working on when it comes to track and trace, for example. But let's move on to the next area or next slide. Again, these are mostly 6 forces that are shaping the healthcare in Saudi Arabia and UAE, as well as Qatar. And forgive me for the title positioning, but again, this is monitored across not only the GCC main countries, but you can see, for example, countries like Kuwait that has been now driving a lot of the growth in the region, especially in 2020, one of the very few countries that has been growing from an economic perspective, but also trying to also find their way in the digital health space. The concepts of bringing together private and public sector, enhancing the patient experience and focusing on user experience in the designing of healthcare solutions, the concepts of care anywhere, hence HIE has become the norm and the trend of the region. Wellness, again, an area of exploration and explosion when it comes to innovation. The demographic nature or the diversity in the demographics of this region has also contributed to making sure that digital is the name of the game when it comes to healthcare. Moving on to the next slide. So this is a simple comparison that I actually I worked with some of our healthcare informatics leaders in this region to come up with, just to look at the 3 major driving healthcare ecosystems for digitization. And you can see there are a variety of models. So for example, KSA and Qatar, they are very similar in the centralized fashion that they're driving health information exchange or building their financial services integration and transaction platforms. Saudi Arabia is a very complex healthcare ecosystem because of the size of the country, 30 million and plus, and the regional, the actual geography of it itself, where they have the rural needs for healthcare services, and hence the dependency on telehealth and digitization. Plus, KSA is the destination of pilgrims from around the world on yearly fashion, which makes it again a super spreader. And the concept of track and trace has become a reality, specifically as pilgrims are descending on KSA, plus the economic growth that is happening in Saudi Arabia. Again, public health and Saudi Arabia has become one of the leading verticals that is driving the digitization as well. Whereas when you look at the UAE, it's like 3-in-1 healthcare systems, driving innovation in 3 frontiers. Abu Dhabi leading the HIE implementation across the whole region and adoption. Actually, they've arrived at around 85% in the HIE adoption across the Abu Dhabi state level, as well as Dubai Health Authority tagging behind just to try and drive the adoption as well from an HIE perspective, as well as in addition to the Northern Emirates, which is the third healthcare ecosystem under the federal umbrella. So, and that's what made healthcare systems in UAE very highly complex, but at the same time, it's completely innovative in the sense that there's a lot of innovation that are running in parallel. However, the ownership is kind of muddled due to the unclear and ambiguous ownership levels. Moving on. And don't forget, these 3 countries rely a lot on expats. So the knowledge, the know-how, the talent, the lack of talent within these 3 major digital health ecosystems have made it very difficult to obviously depend on just local talent because of the huge drive and the number of initiatives and the dire need for digitization. However, if you look at the major focus, UAE seems to have done a great number of strides in implementing and adopting claims post office for the last 15 years. And HIE Abu Dhabi is leading the race to accomplishing fully HIE connected ecosystem between private and public sector. Qatar as well is pushing fiercely to try and implement the health information exchange and the claims post office at the same time, but for a population of 2.7 million, which is attainable. However, Saudi Arabia is the big, the big piece where there is no dominance in the EMR market. There is a huge amount of opportunities to grow. 300 different healthcare inpatient facilities and over 2,000 outpatient facilities just in the public sector. That drives you to think about the enormity of the task ahead. The visions and the strategies that has been put across the 3 countries emphasize that digital is first priority. Digital matters. And that's why these 3 countries are the leading examples of the digitization transformation that is happening across Africa and Middle East. Let me move to the next slide. I think this is just an indication of one of the major initiatives that took place during the pandemic. Actually, in August 2020, what we call the Riyadh Declaration. It's available online. I'll invite you to actually go in and declare and download this document. Phenomenal. It looks at the 7 priorities in digital health, specifically in the pandemic driven world that we are living in. So, and you can see the declaration does rely on the health intelligence, again taking this one step further from artificial intelligence. Interoperability and the concept of data fluidity is another priority, looking at also the use of robotic process automation and artificial intelligence and algorithms to drive decision making, research and innovation. And don't forget the consumption nature of the economies in Saudi Arabia, UAE, and Qatar has become a reality that needs to change to drive more production, more innovation across this region rather than just consumption. And that's what has been kind of an outcome of this forum, is to drive innovation by building talent internally, locally. Quality and effectiveness, driving digital health with concepts like value-based care, accountable care organization models and whatnot, the data governance and the importance of issuing data governance policies, and then finally public health frameworks and always pulling back to under the umbrella of public health, because because of the current situation. And the recommendation, as baffling, and I'll let you indulge in the recommendation as you go through the articles that came out. But again, important emphasis on public health, data governance, workforce, which is a huge aspect. And you will see the same norm in the if you speak to any of the delegation that is coming to the HIMSS conference in person in Las Vegas next week. Last slide, I think. This is another example, some of the countries in Sudan, in Africa that is trying to follow up, to try and find shortcuts, how to build their digital health. And again, this is a simple example that has been also being studied at the moment. Countries like Sudan or Ethiopia or West African countries like Gabon, they are now driven by WHO and United Nations to speed up their e-health implementation. Look at their building blocks and drive value-based care using the current infrastructure, and hence the reliance on telecom and satellite technologies and whatnot. And again, this is just an eye-opener that the next frontier of innovation is going to be Africa. Last but not least, I think the last slide coming up. We are hoping that one day we will come back to normality, specifically as we drive more digitization in this field. And this is just a picture from one of the biggest healthcare technology conferences in the world, Arab Health, that will take place next year around January, February time. I invite you all to also think about coming to Dubai. Again, it's a huge undertaking for people to use the conferences like HIMSS and forums like HIMSS and Arab Health to kind of think about how they can get together to innovate. HIMSS Saudi Arabia is coming also next, and so on and so forth. So definitely there's a lot to come. It's a melting pot. It seems to me that digital health is the melting pot of diversity and sustainability. I really want to thank you. I think there's no next slide, perhaps, just to give you an indication of some of the stats of the power of such forums and digitization in the Middle East. Arab Health brought in Africa, Asia, Europe, and Americas together to try and meet in one area to try and drive innovation. And that's just what normality means to us in this part of the world, how we can use leverage, organizations like HIMSS, Arab Health, and, to bring together the innovation from the West and the East to actually build a remarkable model in the digital health transformation. I think that's the last slide. Perfect. Thank you so much.
Thank you, Mazin. What exciting opportunities you have described in your part of the world. It really it gives me hope that we'll all be able to get boosters and we can all go to Dubai again. So with that, there are a couple of questions that I think have come across. And let's take this one first in terms of, but for Krissa and Doug, after Mazin's presentation, how do you see the international ramifications of the rollout of this blockchain opportunity?
Krissa, you want to start?
Yeah, I can definitely start first. I think, around the world, we have a collective agreement that we need to get to some form of interoperability. We already see it here in the US. Doug pointed out, just policies and regulations that are already in place to ensure that this happens. And I think, we, after, the success of the US, which is, I would say, the most fragmented healthcare system today, we already see, countries like, or regions of the world like GCC really starting to build on what that would look like for their healthcare systems. I think today we all know there really isn't, there hasn't been any blockchain implementations that have scaled to date, and I think we're working towards that. It's still pretty early. But I would expect, in the next, 10 to 15 years, that would be a different story.
Yep. And to echo what Mazen and Krissa said, we certainly see the innovation that Mazen described. I think having seen other international efforts in healthcare. What feels very different this time. I think 10 years ago, it was more fragmented. We saw different initiatives within the US, but across regions. So it made it harder to innovate. On the fire side, this has been an international standard to start. It benefited from when it started. So the technologies of the 90s and the 2000s, the efforts that started during those periods really were hampered by those being transitional technologies, more oriented towards on-premise servers and solutions, pre-cloud, pre-mobile, and whereas fire really started when these standards or the technologies had been worked out. We had really consolidated in the technology area, and the fire standards were built on them, and there's common agreement across regions. This is where we want to go. So people like Graham Grieve in Australia and others started this as an international standard from the start. And so that's been really, really great to see. Mazen would reflect that. And then, as Chris has said, then it's a matter of what's the best way to drive the innovation. We can see efforts like in the Middle East, where countries can modernize their technology as they build their new technology. They can build it using the most modern technologies from the outset. Countries like the US, where we're a mix of innovation in our own distributed way, we see pockets of it, and the technologies allow for it. You can be operating your current older on-premise technologies and also stand up fire solutions in the cloud, and so that the economics and the technologies are allowing for it. So it's really a matter of how each country wants to drive forward, and there's a lot of discussions across countries. So we've had discussions with Canada, which has a very good healthcare architecture, how they want to then incorporate fire, the NIH in the UK, Iceland and the Netherlands, Germany, and then obviously in the Asian countries. But the good news is we're all doing it using the same set of standards. So that really gives us a lot of hope moving forward.
That's great. Well, I'm going to combine a couple of questions here for the panel, because it's, excuse me, Doug, you addressed some of the future challenges that are faced towards fire HL7 interoperability. I think you just touched on that. But when can we foresee a mature interoperability structure, and what competencies need to be further developed? For example, how do we deal with the issues of cybersecurity and those kinds of activities?
Yeah, again, good questions. At the patient level, we're beginning to see these networks get started now. So we see a range of patient apps being developed. We also see the major players. So your mobile phone is ubiquitous. So Apple Health Records connects to these endpoints, so we can interoperate with apps with Apple Health Records. The same thing with the Android, the Google, Microsoft are both innovating from the application perspective as well as the cloud perspective. So that's happening now through these federal mandates. The next wave of innovation will probably be over the next 5 years, where we start looking at moving data using fire bulk data at the population level. The underlying technologies are already supported. JSON, all the cloud vendors are all working to optimize their infrastructure around JSON and now nested ND JSON. So that's coming together. But the drive will be sharing data between entities. I think the older technologies can continue to operate within a hospital. So if I've got data flowing within a hospital, I don't have to upgrade that. But if I'm trying to share it across health systems, that's where we want to focus. And there are new regulations either already announced or coming. And what will really drive it, to directly answer your question, Jonathan, is items that help drive the economics. So where we can enable faster prior auth or automated quality measures, those will ultimately drive it. So we'll have, we'll be able to achieve the same results on the data side with higher quality and lower cost. So it all ultimately comes down to economics and outcomes, and that combined with the regulations, I think, is what we'll see over the next 5 years.
Mazen, do you have any comments in that regard?
Absolutely. So I think the economics is definitely one factor, but we are realizing in this region there is one element that or got a lot more attention in the last 18 months, which is the workforce. Again, trying to find the talent, because again, a lot of the questions in this region, whenever they embark upon digital innovation and transformation in healthcare, the first question is, do we need to recreate the wheel when it comes to standards? So the beauty of just using a one standard playbook, that helps a lot. WHO has released a digital health playbook for underdeveloped or developing countries, which is, again, it helps countries within this region to kind of cut corners and use existing standards to jump in and catch up with the other digital health innovation, specifically when it comes to implementation of interoperability standards, data governance and whatnot. And perhaps that's one area, but once you do shortcuts, you need to build talent. And that's one of the biggest headaches that we have seen as well, because as you look for the quadruple aim, we're learning from the West, cost, quality, experience, whether it's for the end user or the our champions and heroes and heroines who are actually fighting the pandemic on our behalf. They've become an important equation holder or part of the equation, as well as looking at ensuring sustainability. So sustainability does also depend on building the workforce. Blockchain offered a lot of great offers a lot of great opportunities in that sense. In the last 5 years, we went through ups and downs to try and implement it within in this region, and only I think only now people realize the importance of how blockchain can be fitted within the overall digital health architecture, as you said, when it comes to identity and data movement and data security. And that's what has become the name of the game at the moment. Is, okay, we bring in the latest technology, we can implement the apps that are blockchain enabled, but we might need to actually, number one, implement or bring in the talent who know how to develop or maintain such technologies, but also those who are able to put it into context when it comes to clinical, translating it to the clinical workforce, regardless to where this application is developed or what technology is developed under, but the outcome-driven technologies has become more focused on. So I just wanted to add the talent acquisition and retention piece.
Well, that's a very, very, very critical and important point, and I think that's applicable all across the universe for us too, in the United States and other countries, making sure that the talent is available, particularly as it gets down to the patient and provider level for in terms of understanding that. And that's leads me to a final question: is how do we see the role of patient access versus healthcare and payers in terms of portability, and what would be needed to get that kind of confidence to down to that level that they would be eager to participate in the sharing of this kind of data? Kristen, why don't we start with you?
Great. No, that's a big, wonderful question. And speaking in, as a use case with Patientory and essentially how we have positioned ourselves in the marketplace is really as from a ground up level, grassroots. So it's really driven by patients. As we know today, a lot of what has been built, has been focused more or less on, revenue cycle management and the provider side. However, we're just now seeing the initiatives to really empower patients, to really start to bring patients into that fold and have them access their information. So with the solution, with like blockchain and Patientory, the focus of decentralization, right? And bringing that ownership back to the individual is a messaging that we really take, in everything we do. But we really see this emergence really coming from, empowering the users. They're the ones who are going to be, asking the questions, are going to be, sharing that information with organizations. And I think once we get to that critical mass and mindset, we'll truly have a healthcare marketplace that's centered around patients.
Doug, do you want to address that as well?
Sure. I think Chris talked about empowering the patients. That's absolutely right. It's been really gratifying to us to see, the government innovation, which is unexpected, where the government led with Medicare Blue Button in terms of giving patients access. And then we're now essentially implementing the equivalent on Blue Button APIs. So with Blue Button, you can develop an app, patient can pull all their Medicare data to the app of their choice. We're now enabling exactly the same thing. In fact, just over these last several months at a state level and a commercial level for health plans. So, there's trepidation because the healthcare to date has been about protecting as we move the data on behalf of patients, but the movement is really to empower patients. This is our health records. Congress has mandated it. We need to get comfortable sharing things like doctor notes. That was a big, the patient advocacy groups really were pressing for that. When the regulations actually came out, it did include doctor notes because there's so much critical healthcare information there that it's important as we move through the healthcare system that we can easily share that. And so seeing that combination has really been critical, but these are early days. So I think education is going to be important. I think getting people comfortable that they can and should take ownership of their healthcare data. Now that these regulations are coming into play here in 2021 and 2022 in the US, and Mazen and other innovators internationally start to make these available, I think we'll start to get used to having healthcare data in our possession and give us a chance to see, is this what I expected? Are there surprises? Can I fill in the gap? So we're just at the outset, but all the pieces are there, including initiatives like CRISA with Patientory that address the security. So, really looking forward to what we see in terms of innovation over the next 5 years. But without the regulations, it would not be possible. So that's what's so affirming, is to see that and then see the innovations internationally as other governments work to do the same thing for their citizens.
Thank you.
And Jonathan,
think-
if I may just
Mazen,
one
please.
minute to that, just 1 minute. So I just think what Doug and Carissa has said is absolutely critical, and it's revolutionary. You know, the word patient might be limiting to us, to one industry. What Patientory Association has done is become a melting pot for regulators and industry and education and research into one, breaking barriers between stakeholders in healthcare. And that's the first step for healthcare to be broken into other industries. As we rely on the word patient, soon we will drop the word patient and substitute it with user, and becomes Patientory Association could be the role model for other associations to bring healthcare out of its silo and integrate it across other industries, aviation, hospitality, which has become the norm of our post-pandemic era, using blockchain as a trajectory for other technologies to follow through, whether it's artificial intelligence, quantum electronics, and whatnot. And that's what I'm thinking is user app and the ownership of people to their to their medical record will burst out of healthcare, and it will go across industries, as public health has become the DNA of all the other industries in the post-pandemic era. And Patientory Association has presented a model that has been worked on by melting the silos between the stakeholders within, in preparation to melting the silos beyond. Thank you.
That was a very insightful piece of information, Mazen. Thank you very much. I would add in that one of the things we didn't talk about, and perhaps a future webinar could address that, is some of the changes that will have to happen in at least the United States in terms of the Health Information Portability Act, HIPAA, to be able to assure this kind of interoperability and information exchange. I think we also have to talk about some of the economic ramifications for all social strata of individuals. And while the cell phone is becoming ubiquitous and more affordable, I put that in quotes, down if you want a new iPhone 12 though, becoming more ubiquitous and available, how that will be used and how it will be protected from, again, back to that cybersecurity concern, is a subject that we should look at further in depth. So, Carissa, do you have any final comments relative to Patientory Association, or HIMSS?
No, thank you. No, that was Mazen and Jonathan. Thank you for that wonderful insight. This another amazing webinar, and I think in regards to HIMSS, we hope that you can join us virtually, or if you're going to be there in person, to continue the dialogue.
Thank you. I think that concludes our conversation today. I want to thank everyone for joining us. If you have any additional questions, you can contact Patientory through their website, Patientory Association, through its website. And have a great day, everyone, or evening, wherever you may be. Thank you. Goodbye.